35-year-old Neil from Coventry, an aspiring musician who's not so much worried about his teeth as their foundations. Years of rock and roll instead of floss and brush have left his choppers hanging by a thread.
When I'm singing, I'm okay and behind a microphone, but when I see pictures of afterwards, that's when I'm disgusted a bit, really.
Hey Neil, how you doing? Really nice to meet you. Have a seat. So, how can we help you?
Have a look at my teeth.
Okay, and so what are your concerns about your teeth?
I've got loose teeth at the bottom, teeth missing at the top. There's fillings there. I get some discomfort.
And have you spoken to any other dentists about your concerns?
No, I just don't want my teeth out. I'm trying to hang on to them, I guess.
Okay, fine. Pop yourself back in the chair and we'll have a look and see what's going on.
When you first see them, Neil's teeth don't look too bad. But look what happens when James puts in the periodontal probe.
It's very clear that some of these teeth on the front at the bottom are really quite loose. And there's some other teeth scattered around that are more loose than I'd like to see, but it's certainly these lower front teeth that cause me the most concern to start with. So, I mean, this is the picture of your teeth, and I'm sure you're aware the main issue in a case like yours is the health of your gums. And you do have very advanced gum disease, and that's most severe around the lower front four teeth. And to be honest, we're not going to be able to save these front four lower teeth. That's not necessarily a bad thing, because we can replace those with something that's going to serve you absolutely fantastically for a long time to come. Around the back teeth, it is classed as moderate to severe, but those teeth, with a lot of good help from a hygienist, could last you a very, very long time. Neil really has no decay at all, but he has very extensive bone and gum disease. And to the extent, really, where one of his teeth isn't in any bone at all, so it's been purely held in by the soft tissue of the gums, which for someone of his age is really quite extreme.
The best way to tackle gum disease is with a mega clean-up from a hygienist. It's caused by a build-up of bacteria that separate the gums from the teeth. With 3 out of 4 UK adults suffering from it, it's the nation's biggest cause of tooth loss. And if the thought of losing your teeth isn't enough, recent research shows that it can increase your chances of getting heart disease. Someone else with gum disease is musician Neil. His is so bad that he's likely to lose a lot of his teeth. Embarrassing Body's dentist James has sent him for 7 weeks intensive hygienist treatment to clear the infection and save some of his wobbly gnashers. It's a big night, Neil's last rock performance with rocky teeth. Neil might not have been crowned the king of rock and roll just yet, but at James's surgery next day, there's to be a different crowning ceremony.
So how's everything been going since I last saw you?
Seems going really well. Seem to be bleeding a lot less at night time. In fact, hardly any at all. When I'm brushing my teeth, it seems a lot healthier. The gums feel less sore than they used to, for a start.
So the hygienist has basically made it possible for us to completely save all of your top teeth, which is great news, because left unchecked, 1 or 2 years later, we've been losing a lot more teeth. But it's these front four that we know can't be saved.
Over the next week, Neil's treatment comes in 3 stages. The first is to save what can be saved with crowns.
The crown is basically a porcelain restoration that goes all the way over the tooth. And basically, in a case like Neil's here, the tooth has been so broken down and heavily filled that it needs the extra strength to hold it all together, to cover it up, but it also makes it look a lot nicer as well.
4 days later, stage 2, removing the 4 teeth that can't be saved.
So what we're doing here is we're just really gently just giving these teeth a little wiggle. And because these teeth are really in very little supported bone at all, if any, they're coming out really, really, really easily.
Stage 3, replace what's been taken out with a denture.
That's great. It's completely perfect. And actually it's clicking in really, really well. So you're not going to be able to just flick this out when you're speaking or singing or anything like that. No way. Here's the mirror. You can have a little look at what we've got at the moment.
Oh, wow.
better than what you had before.
Right. I'm really pleased with the results. They look like, you know, real teeth. I can't feel anything yet at all because I'm still numb, but yeah, they look great. I'm really impressed.